You're listening to The Social Workers on WCDB Albany.
And you're listening to The Social Workers here on WCDB Albany. Don't want to forget the B there. My name is Eric Hardiman, and I'm back in the studio live here with Alyssa Lotmore. Welcome back, Alyssa.
Hi, Eric.
So we've had a great show this morning so far, and the fun continues. We've got another live interview here. In the studio with us right now is Dr. Nicole MacFarland. Nicole is the Executive Director of Senior Hope Counseling Incorporated and Executive Director of the Senior Hope Foundation. In May 2014, she graduated from the University at Albany's School of Social Welfare Ph.D. program. Her dissertation focused on geriatric addictions. She's currently Clinical Assistant Professor for the School of Social Welfare and Clinical Associate Professor for the School of Public Health Policy, Management and Behavior for the University at Albany. Ms. McFarland is the recipient of a Hartford Doctoral Fellows Pre-Dissertation Award and the 2009 Individual of Distinction in Addictions Education and Training Award for New York State. In 2010, she was honored as Social Worker of the Year for New York State at the Annual NASW New York State Conference. Over the past 25 years, Dr. McFarland has published 2 book chapters, several articles, developed online courses, and has lectured locally, statewide, and nationally. So we're excited to have you with us today, Nicole. Thanks for being here on The Social Workers.
Thank you so much, Dr. Hardiman and Alyssa, for having me here today. It's such an honor to be with you.
Well, this bio is amazing. Congratulations on all your accomplishments, too.
Thank you.
I'm one of our alums. That's even, I'm like, yay. So let's just jump right in. What roles have you played at Senior Hope?
Well, Alyssa, over the years, I've played several different roles at Senior Hope. I started out back in 2004 as Clinical Director of Senior Hope Counseling, working under Dr. William Rockwood and Adrian Rockwood, the founders of Senior Hope Counseling. And it was such an honor working with this incredible couple who are pioneers in the field of geriatric addictions. So during that time, from 2004 to 2012, we listened very carefully to our patient population to develop our clinical programming according to the unique needs of older adults struggling with substance use disorders. When Dr. William Rockwood retired in 2012, I stepped in as executive director of the facility, and it's been an honor to work in that capacity ever since.
Great.
And for those who don't know about Senior Hope, can you give us a little overview of what it is, its mission, the programs and services they offer?
Certainly. Senior Hope Counseling is the only freestanding, OASIS-licensed, outpatient, non-intensive clinic catering exclusively to individuals 50 and older who struggle with substance use disorders. And it was founded in 2002, as I mentioned, by Dr. William Rockwood and Adrian Rockwood. The mission of Senior Hope Counseling is to provide quality, evidence-based, comprehensive addiction services to older adults and their families in a compassionate setting. And we've had the privilege of serving older adults over the years and their families, and learning a great deal about what is needed for this unique population.
And we know that the demographics are changing in the United States, and we talk about the aging of the population and that there's increasing numbers of older folks in our population. And so I wonder if you could tell us a little bit about some of the themes that have emerged over the years that you've seen in working with older adults.
Certainly. There are a multitude of themes that have emerged, and what we have found is that older adults benefit greatly by being among their same age group, talking about age-related issues. There is, as we all are well-versed, an opioid epidemic here in our community and nationally. And it is not uncommon that older adults seek out attention for their physical ailments from their primary care physicians and specialists. And what we've noted over the years is that it is not uncommon that these older adults then experience dependency on the pain medications and then may start to pursue heroin as an alternative. So part of what we do at Senior Hope is to provide education and training and group support to these older adults and their families, and communicate effectively with their primary care physicians and other individuals involved in their care, so there can be greater support for these older adults.
Sure.
Now, what about trauma-informed care? Trauma-informed care, I should say, and how is that connected to the treatment that you do at Senior Hope?
Yes, trauma-informed care is so critical, and this is one of the themes that has emerged as well. We have come to realize that older adults grew up oftentimes during a generation where services were not in place to really help insulate them from early childhood physical, emotional, and sexual abuse. And so we are very much involved in the work with Dr. Heather Larkin and Dr. Catherine Breyer-Lawson. We are part of the HEARTS initiative and have been integrating adverse childhood experiences questionnaire into our programming for many years. This has been instrumental in helping to inform our treatment programming. We have found that a lot of older adults do not realize that what they experienced prior to age 18 in terms of trauma has really a very strong correlation to long-term substance use disorders, physical impairments, and or mental health issues. So by having this clinic that is specifically focused on working with older adults with substance use disorders, that is trauma-informed, we are able to provide a safe, nurturing environment and provide not only individual therapy, but also group support specific to this topic.
I know that direct care for older adults sometimes and often takes place in the home with family members being caregivers, and that family caregivers of older adults don't always have the supports they need to do that type of work. Maybe they didn't envision themselves as being a caretaker initially and then had to transition into that role because of a health crisis. What are your, sort of thoughts, and how does your work at Senior Hope relate to caregivers as well?
It's very important when working with the older adult to realize that the health of the older adult impacts 3 generations. It not only impacts the adult children, but it also impacts the grandchildren. So if we're able to help educate and support not only the older adult who walks through our doors, but also to provide support to the caregivers, oftentimes the adult children, then that can have profound implications on the grandchildren, great-grandchildren as well. And one of the components that we offer is awareness of resources in our local community, because fortunately here in the Capital Region we have a plethora of supports available for individuals struggling with substance use disorders and also individuals in need of senior service care. So we oftentimes reach out to the New York State Office for the Aging, Albany County Department of Aging, Meals on Wheels, Senior Services of Albany, and a variety of other agencies to provide insulation to the older adult and to help educate the caregivers.
So what can you share with listeners to help them if they are a provider, a caretaker or individual in service, who is in need of services? What are some resources or information that you can share with us?
Well, first and foremost, if you start to see the older adult exhibit significant changes in their ability to maintain daily living skills, such as hygiene, such as managing their checkbook, such as maintaining their living environment, those could be significant indicators that there may be a problem, and it may be correlated to substance use disorder and or decompensation with mental health, cognitive impairment. So for a provider or adult child to be aware of any significant changes that they seem to be observing in that older adult's presentation that may come on suddenly. Another example would be unexplained bruises, individuals who are incoherent, confusion, and such. There are times that the individual may need a more intensive level of support, such as a hospitalization or a neurological workup to determine if there's cognitive impairments going on. The individual may need to be insulated with higher level of care for housing and monitoring of medication, because as an individual ages, sometimes it is difficult to maintain all these daily living skills.
Now, with the growing, the baby boomers aging, and you said there's the opioids, and what is that like right now for Senior Hope? Do you have enough Are there enough resources for individuals, or what's the sort of the status right now with all of this going on?
Well, I'm really glad that you're asking about that, because we recently became involved with the State Opioid Response Initiative here in New York State, and we have an individual who is about to receive his Ph.D. here at University of Albany, Darren Cosgrove, who is our clinician working with the State Opioid Response Grant. He will be providing on-site and off-site services to those individuals who have barriers to treatment and who live in rural communities and may otherwise not be able to receive treatment at a location like Senior Hope. So they'll be going out to Bern and other locations to really engage in outreach. In terms of some of the trends we've seen at Senior Hope, when we've looked at the statistics, they have ranged anywhere from 2% to 11%. And right now we have 9% of our patient population struggling with primary substance use of opioids.
Wow.
Predominantly over the years, since 2004, alcohol has been the primary concern among the older population. But as we see greater numbers of individuals in need of our services, we're going to see some changes among that focus, and it'll be diverse. It won't just be alcohol as the primary.
Well, that's something that your agency is always have to be up to date on, I guess, is to what are the new trends, what is the need for our services, what are people going through that we might need to have enough supports in this area. So that's something that it can be challenging to always sort of know and sort of expect and be able to prepare what's sort of coming at us.
And we're very excited, Dr. Hardiman and Alyssa, over the fact that this past March, we moved to a larger facility at 650 Warren Street in Albany, where Capital Counseling is also housed. And that new space is going to allow us to expand into medication-assisted treatment on site, which will result in our medical director being able to provide Suboxone and other medications designed to help meet the needs of individuals struggling with opioid addiction.
So, in addition to your sort of administrative leadership and work that you're doing clinically at Senior Hope and the Senior Hope Foundation, you're also engaged in education and training efforts, and you're teaching here at the University at Albany. Can you tell us a little bit about, both in social welfare and in public health, sort of what those teaching efforts are like, and what surprises people about the older population, and what are some of the challenges that you face in teaching in that arena?
Yes, a lot of times when I've lectured locally, statewide, and nationally, the thought is, well, let the older adult just enjoy, and they're not really harming anyone. It's not really impacting at the job because they're retired. They're not raising children, so it's not impacting, raising the children. And so what I say oftentimes when presenting is that the older adult has a major influence on the entire family system. And when the older adult is struggling with substance use disorders, it has residual implications on many generations. Oftentimes we say to the older adult, what kind of legacy do you want to leave behind? Do you want to be remembered as mom or dad, grandma or grandpa who passed away in a drunken stupor, or do you want to be remembered as grandma or grandpa, mom or dad who had a vital relationship with their children and grandchildren and ended their life clean and or sober? So my experience in having this incredible opportunity to be part of SUNY Albany's School of Public Health and School of Social Welfare is that I am in a position to help train and inspire the next generation of leaders in the field of geriatric addictions, mental health, and physical wellness. And oftentimes, students and or individuals seated listening to some of the presentations are under an impression that, older adults should just be left to do what they would like to do, and a few drinks doesn't matter. But part of the education we provide is that older adults are often on a multitude of medications for physical impairments, and even one or two drinks can have profound implications on their ability to walk and maintain.
Well, it's the whole aspect of every no matter what age you are, your life still matters. What you're doing, it still matters. Your health still matters, and to be able to invest more and not, I don't want to say like give up on people, but just not sort of dismiss them. Oh, they're at this part in their life. We don't need to provide services. We don't need to, help them through this because they're not taking care of kids or they're not working and things like that. So it's great that there are resources for individuals who are going through some type of addiction as an older adult, and to be able for them to regain what they want in their life in terms of relationships with family, leaving a legacy that they want.
Yes, and we often reflect on this whole concept, Alyssa, of meaning and purpose, because it's not uncommon that as an individual ages and may be retired or disabled, they start to question, what is my purpose here in life and what value do I have? So part of the work we do and the education and training we provide is to help the older adult realize through the productive aging theory that they have great meaning and purpose, that they may not be able to do the same things they once did when they were in their 20s and 30s because they're experiencing changes in their cognitive capacity, in their ability to walk and hear and such. But it doesn't mean that they can't stay engaged in their communities and in their families and get involved in activities that give them great meaning and purpose.
So if you've just tuned in, you're listening to the Social Workers Live Radio Talk Show, and we're talking here in the studio with Dr. Nicole MacFarland. Nicole is the Executive Director of Senior Hope Counseling here in Albany. What's coming in the future years for Senior Hope? What do you think are the next challenges and the next set of goals for the organization?
Well, we're very excited as we look to 2020 in terms of expansion because along with the SOAR grant, State Opioid Response Grant, we recently received a grant through DSRIP, Delivery System Reform Incentive Program, through BENNY, the Better Health of Northeast New York. And we are offering off-site services and on-site services through Hudson Park Rehab. There are so many individuals who are experiencing injuries due to alcohol or drug-related occurrences. And so we are providing a social worker at Hudson Nursing Facility so that they can integrate primary care and behavioral health right there. When the individual is ready for discharge, we offer on-site services at Senior Hope for continuity of care. So that's what we look forward to in 2020, as well as medication-assisted treatment on-site. And we have been involved in writing several grants and look forward to seeing how they unfold in the upcoming years so that we can continue to expand our services at Senior Hope Counseling.
And if people are interested in learning more about Senior Hope, it's the website is www.seniorhope.org. You also have a Facebook page, Senior Hope Albany. So there are ways that people can contact and find out more about your agency, or if they want to be connected and get resources. There is a easy way to get to you guys.
Absolutely. We're here to be supportive and help.
Well, I want to thank you so much for coming on and sharing information about Senior Hope. I mean, we hear so much about addictions right now in the news and what's going on, and there's so much research that older adults are ones who are really impacted by this right now. And to know that there are resources right here in the Albany community that, and to relate to a mission, because I think there might be ways to provide services, and there's many different organizations, but really the mission of each organization I think is important when people are looking for what is the best place for me to get services or get assistance. So
absolutely,
thank you so much for sharing more about Senior Hope and sort of the not only the program offerings, but what you guys stand for and how you view those that you're working with and interact with them.
Yes, we're very grateful to this older generation, and we believe that they should be supported and encouraged and feel productive at this stage in life. So we want to help them to get to that point, especially if they're struggling with substance use disorders.
Great. Well, thanks for all you're doing for the Albany population and for the older adults in this area and their families. It's really important work. We've been talking with Dr. Nicole MacFarland, and it's really nice to have an alum of the School of Social Welfare back here. We always like to support our alumni and to have folks come back to the radio station and sort of share their expertise and their experience with us.
Yeah. And I think it just shows how broad the social work profession is. I mean, we've had a lot of alums come on, and everyone's talking about something different and different resources, community resources for people, and just all the different pathways you can go with a social work degree. And it's great to have you on and to share not only your expertise, but also about an agency that is an asset to the community, that people can utilize and have as a resource. So thank you so much.
Thank you. It's just been an honor having my education through University at Albany School of Social Welfare, and I really appreciate Alyssa and Dr. Hardiman being on the show today. Thank you.
Great, thank you. So you've been listening to the Social Workers here on WCDB Albany. I'm Eric Hardiman, and as always, here with Alyssa Lotmore. Alyssa, can you remind our listeners, as we always do, where they can find us on the internet?
Yes, we are. You can just search the Social Workers Radio Talk Show. We have all our episodes archived on the Social Workers Radio Talk Show.simplecast.fm, or you can just find us on social media, and we're at Social Workers FM. So lots of different ways to find us.
iTunes, I think, too.
We are on iTunes.
So
you can subscribe to us. Yes. So you can never miss our show. We're always there. We are taking a few weeks off for winter intercession, but we already have guests lined up for January, and we will be back. So exciting time.
More episodes of the Social Workers to come in 2020. That's going to be interesting, getting used to saying that. Thanks for listening to the Social Workers here on WCDB Albany.
You're listening to The Social Workers on WCDB Albany.